If we continue to behave normally, this disease will treat us abnormally.
And that's a conversation we're having here throughout this week. 14 minutes past 8 a.m. This is Morning Vybez, and I'm your captain of good vibes. They call me Kwambox.
And Mbunde here in studio.
And in studio, we've got Dr. Korir. We're so grateful that you're here this morning with us. Karibu sana.
Asante sana.
Now, we had to, I know I called you yesterday emergency. Doc.
Come through.
As soon as I finished the show at 10 a.m., I think 10:15, she was the call I was making.
Yeah.
Why? It's shocking to hear what Kenyans are saying about COVID. And I want us to start with a caller who made this comment yesterday. Take a listen.
Hii kitu naona tu kama kihoax tu. Wewe kwanza nikuulize wewe, umeona mtu ako na COVID?
Hapana, lakini tumesikia mtu amekufa.
Sasa mimi najua kwa TV nimewahi ona mtu ako na ukimwi. Unacheki Brayo? Unaona ndio huyu unaonyeshwa. Lakini ya Kenya hakuna mtu hata ziona mtu ako na COVID. Alafu huku Isiolo kumekuwa tu na cases lakini unapata ni tu uongo. Mimi kitu sijaona ndaamini aje kwa box.
There about how many people have been tested? About 200 or 100,000. Something like that. 100,000. Cliff, let's do math. 100,000 people have been tested, 100 and something thousand. And in total, tuko 47 million people.
Exactly.
Sasa, imagine ingekuwa in your area, ungejua kawa say wakumi. Don't you think ingekuwa more populated in your area, right? It's not possible. They are spread out.
And then, najua watu wase na mabeste na family hata Nairobi. Na hata Mombasa. Lakini hata hakuna best yangu na wapigia na uliza wewe umemwona huyo mtu hata kwa nebayoni umeona msee akikamiwa? Hapana. Hata ajui mtu yote ako nayo. Mimi nacheki tu naona mimi hata sielewi kitu inaendaje. Alafu in the other hand, naangalia naona kwa media, sasa ile ya media. Unaangalia kama huko Italy unaona watu wamekufa kwa streets, unaona ndio. Hawa ni watu wamekufa. Si kuna hizo videos kwa YouTube na kwa social media. Watu wamekufa kwa street Italy huko wanaokotwa. Unaona watu wako quarantine kabisa kwa manyumba mpaka unapata DJ na mix ya kwa balcony watu wako kwa manyumba, unaona? Lakini ya Kenya mimi naona tu mtu akipimwa watu wamevaa manini, sijaonyeshwa mtu wa COVID ni tuambiwe mse sasa akona COVID, kwa hivyo kaeni rada. Unaona venye anakaa? Unaona venye tunaambiango ukimwi, unaona?
Cliff, yani unataka uoneshwe mtu picha akistruggle akikuwa huko kwa nini kwa ICU ndio ujue hiki tu ni real.
Kwambox, what I cannot see and touch I cannot believe in.
All right.
Justified because as human beings unataka kuona kitu so that you can relate with it. But as long as hauoni then it doesn't make sense to you. And then vile anasema the way at the very beginning tulikuwa tunaona sana I think it started with China. We saw some bodies being collected on the streets. Then wakaenda Italy. Italy was the next hardest hit place. Then the US where things were bad. The reports were like, it's bad. The system is overwhelmed. And so we thought now when it comes to Africa, we'll see a totally different thing. So when that didn't happen, then it becomes difficult for the human mind to relate what you are expecting and what you are seeing. And what we are seeing for me is not a surprise. Kumbuka Kenya iko na mayouth wengi. If you look at the Kenyan population, wengi ni mayouth. Na hii ugonjwa imekuwa ikiaffect nani? The elderly. Most of the people who've died have been elderly, ama watu ambao wako na diabetes, hypertension. My youth, chances are of having diabetes are very low compared to now watu wa old. So even when they get the virus, hakuna kitu inafanya. You'll just not even know that you're carrying the virus because you'll not have any symptoms. So that could be part of why we are seeing what we are seeing, and the numbers are not as dramatic. Watu wanguki kwa streets, sijui unasikia watu wanaumia wanadai kwa nyumba. It's not happening because of the demographics ama vile population ya Africa iko, population ya Kenya iko.
Because that was going to be my first question. When we looked, when kwanza March, was it March? We sitting here saying, it's coming, it's coming,
Yes.
And then the president announces and we're like, and the only thing we've seen is the two patient A and her boyfriend.
Yes.
But we've had many other patients that we've covered across board from many media houses. But I think ni kwa sababu the people you're seeing are otherwise healthy. Uoni wale watu wako kwa oxygen, they are struggling to breathe. Ama unaona madaktari, they are struggling to revive somebody. Atuoni those pictures the way we were seeing in the West. And also ukiona the number of critically ill patients, ama wale watu ambao wako in very bad situation, they are less than 30 across the country. So you don't expect that you will see watu kwa oxygen, kwa ventilator, watu wanalia nini. You don't expect that kind of picture. So unaona 90% watu wote 8,000 ambao wamekuwa diagnosed, 90% do not have any symptoms. So labda hata sisi wenye tuko hapa we are healthy. Na labda tuko na COVID na hatujui.
Mimi niko hoa lakini niko na COVID. No, I have, you know, now Brayo ukisikia hivyo. So utaanza kubehave ka Collins, ni Cliff.
I'll start behaving normally. And you know the saddest thing is that there are so many videos surfacing online za kushow wase kwa hizi COVID centers.
Wanakula githeri kwa floor.
Wasikiza tu ngoma wana dance.
They're having fun because watu hawana symptoms, who are not sick. You see, when this thing started in March and we started seeing that people see wagonjwa vile, we're like, if people are not that sick, then let them isolate at home. Hakuna haja ya kuweka watu hosi because this thing really, apart from fever and a cough, if somebody ana any of those risks, diabetes, hypertension, cancer, ugonjwa ingine ama ni mzee, there's no point of them being in hospital. They can stay home. But sasa unaona gava ilikam na this is very bad. It is, you know, painting a really grim and very bad picture. So ikaogopesha wase. So people are feeling like, this thing is really bad. So now when you want them to stay home, it becomes difficult because mtu anaona nitaka home naeza die. So wakienda hosi, you realize hata kwa hosi unajua hakuna dawa yetu mtu anapewa. Because if you're like this, unapewa dawa nini? Unless you have a fever, upewe paracetamol, there's nothing else you'll be given.
Doc maze, unajua sahi watu sasa wenye umesema hivi, mtu hata alikuwa a plan kwenda ushago.
So this is now the thing, my youth, hata ukiwa nayo unaweza sambaza, wewe itaku affect. So imagine ukienda ushago, your grandparents are there, they are elderly, wako na probably diabetes, hypertension, kuna wenye ambao wako na cancer, kuna wengine tu wenye ni wazee. Ukiwaambukiza, chances of them surviving is very low. So utabebana na hiyo conscience that uliambukiza your grandparents and cause them their death. That is why
mtu hapa anashanga mtaa nitajuaje.
But that's why unaambiwa if you don't need to travel, don't. Because unaona kuna watu wanataka tu kwenda tu for the sake of kwenda kula raha, sijui kufanya nini. If you don't need to travel, you should not stay where you are. Because you might have it, alafu wapeleke. Wakikufa COVID kwa sababu umewapelekea utasikia aje? Will you live with that?
The conscience.
With that conscience.
Brian, we're going to take a short commercial break. And I want our MVPs to call us up and whatever questions you've got for Dr. Korir. I got to tell you, Doc, you are painting a very different picture from the conversation we're having. Mimi remember by the way, kohoa kauna. Kohoa inwards.
No, sisiniz.
Rudisha. Do not allow that thing out. 22 minutes past 8 a.m. The number you need to call
0719012700.
Because Dr. Korir is here to answer all the questions uko nazo za COVID-19.
Good vibes only on Vibes Radio.
Cecile bringing us to 8:25 a.m. You listen to Morning Vibes with me, Mbunde and Kwambox. Shout out to everyone who's coming through at this hour. And today we are talking about what questions do you have about COVID-19? Because so many people out there think it's fake, whether ni government propaganda to make sure that tumebaki indoors. Kwanza daktari, hii curfew, unaona inasaidia ama ni COVID tu inasambaza usiku?
No, curfew inasaidia in that ukiangalia what time are people likely to go to bashes, to clubs, at night. Alafu sasa ukimagine umeenda club, you may go and start with proper physical distancing. By the end of the night, hata ujui umepatana na nani, umemix na nani, labda umeguza glasi ya mtu mwingine, chupa ya mtu mwingine. So that environment alone is very high risk. So curfew inasaidia in that sasa huwezi fanya hizo activities openly. Banajua kuna watu tu bado wanaendelea tu na mabashi, closed places, house parties.
Doc, are you ready to receive some questions?
Yes, let's say.
All right. We got Cliff from Isiolo. This is actually the guy who is the Cliff guy. Hi, Cliff.
Hey, Kwambox Mbunde.
Uko fiti?
Mimi niko poa. Habari ya Bunde?
Niko salama sana bro.
Poa. Habari ya Dr. Masi?
Poa sana Cliff.
Aya, mimi swali yangu ni moja tu, nani simple. Mimi nataka kuuliza Dr. Masi aje. Mimi nasikia kuna wase wanapona. unapata the hawa wako infected and these ones have recovered fast. Kuko na dawa ya corona?
Corona haina dawa, haina vaccine.
So hawa watu wanapona daktari? Wanaponaje?
So hii definition ya recovery hapa ni ulipimwa mara ya kwanza ukapatikana na virus, wakangoja for like 14 days. Within these 14 days wana expect kuwa umesha shed hiyo virus like mwili yako imeifight, it has gotten rid of it. So after 14 days wakikupima ukuwe negative mara mbili, then ndio wana define kama mtu amerecover. So si ati ulikuwa msick unakufa sasa umeanza kufeel poa. Lakini kuna wale ambao labda walikuwa na fever ama wanakohoa, ambao wenye sasa hiyo fever imeisha, kukohoa imeisha, so you feel better. Una imagine kama vile tu labda umekuwa na homa ya kawaida, umekuwa na mafua ya kawaida. Ujitibu na dawa, ndimu, ginger, asali. After sometimes una feel better. So hiyo ndio recovery. So more or less hii coronavirus ni kama tu mafua kawaida. Only that sasa ikipata mtu mwenye ako na risks kama mtu mzee ama mtu ako na kisukari, hapo ndio hata survive.
Kwa hivyo si ati iko na dawa wenye wana recover ni tu, it is just normal remedy.
Ni normal remedy tu na immunity yako tu kuifight. Mwili yako kufight. Ndio sababu tunaambia watu kula poa, kula vitu za garlic, ginger, lemon, ziweke kwa diet as your everyday regimen. So that in case uipate, kwa sababu chances are unaweza ipata, mwili yako iweze tu kuifight because haina dawa.
Okay. Na wenye wanapona daktari, inaisha kabisa?
Inaisha kabisa, yes. Inaisha kabisa. So unless sasa waipate tena. Lakini ukisha ifight, umeshapona, umerilisiwa, hautatiambukizana. Because ninaona kuna watu ambao wanaona mtu amerilisiwa wanaanza kuogopa, sijui atatuambukiza, sijui nini, hapana. Kama tu mafua, ukishapona homa siko sawa. So think of it like that.
Ukipona homa na kuanga fit. Okay.
Cliff uko sawa?
Kwambox. Wacha nifikirie swali lingine.
Haina shida.
Kifika jokes yake doke leo.
All right. Thank you so much, Cliff.
Okay.
Cliff there from Isiolo, and he seems satisfied with the answer. Let's hear from someone else. Hello, good morning.
Hello.
Sasa.
Safi sana Sheila, ni Kadere from Kitale.
Karibu sana Patrick.
Niko safi kabisa. Mgeni wetu habari yake?
Ako salama mgeni.
No, ni mzuri kabisa nikisikia wewe. Mimi nasema hivi. Mimi ninauliza swali, naona mnasema mtu wengi ndio wamepona. Na hao wakipona inamaanisha tena uwezi ambukiza tena, uambukize ugonjwa ukienda mahali pengine. Hebu mnasema tu mtu akipona inamaanisha yani ni umepona, umeisha kabisa, unaweza tembea. Alafu swali la pili. Mlitangaza kwamba last week but hata nikaambia hao watangazaji hapo kuna area yangu wameshika watu wawili ati wako na COVID-19.
Kitale. Lakini
imepatikana hawakuwa nayo. Na kulingana na statistics za serikali wametangaza kwanza Kitale iko na watu wawili na kumbe hakuna. Kwa hivyo tunaona hesabu yenu ya serikali inaenda home. Mnatangaza unasema watu wamepatikana na hakuna, kumbe mnaharibia watu jina. Je, wenye wameharibiwa majina wanaweza lipwa?
Kadere. Mgeni wetu si wa government.
Pole mgeni, nimetoa hiyo.
Asante sana Kadere.
Asante, nijibu hayo maswali yangu.
So that's Kadere from we'll take two more phone calls. So he's at the question again about reinfection.
Yeah.
Julius from Mombasa, good morning.
Hello.
Hi.
Hi tu.
Haya Julius, uko na swali gani unataka kuuliza daktari juu ya COVID? Julius amejikata. Michael.
Hello.
Hi Mike.
Morning. How are you?
Good. What question do you have about COVID you'd like Dr. Masi to answer?
What's the relationship between COVID and homa, asthma, and age?
Okay, that's a good question.
Age? Yeah, what about age?
Okay.
Well, you hear that, for example, in the speech yesterday, he said that from 13 below wasiende kanisa, 58 and above wasiende kanisa. What is the relationship between COVID and age?
Okay.
That's a good question. Thank you so much, Mike. We're going to let's answer those questions.
Okay. So we'll start with Kadere about the reinfection. So you remember this virus has been here now 6 months. Yeah. So people are still trying to see those people who've been infected, how long can their immunity last. So that is still something that people are working on. Kujua kama ukishaipata you get immunity such that hata if you're exposed to the same virus wezipata your disease again. But now the thinking currently is that ukishaipata once, then uko protected for like a year or two. That is the assumption, because going by kumbuka hii COVID is in a larger group of viruses ambayo inaitwa coronaviruses. So this many coronaviruses, just one of them is COVID. Zingine ni kama SARS, MERS, and na homa, the common cold. And sasa nitajibu hiyo niki when talking to Michael about what is the relation with homa ya kawaida.
Is H1N1 also a corona?
That is a flu now. That is influenza.
Okay.
So that's different. So now going by how the coronaviruses behave, what one assume that ukipata then uko na immunity for like a year or two. But at the moment, since we are too sure, we're just advising that hata kama umepata, just observe the measures. Vaa mask, osha mkono, sanitize, all of those things, clean your surfaces, because we are not sure kama unaweza ipata tena. So the important thing hapa lakini ni mtu mwenye ameshaipata akapona hana tena kitu ya kusambaza, because if kama leo niko na pesa nitumie nikule yote, kesho sina. So it's the same thing. So if you have it today, ukishapona, tomorrow you don't have anything else to give. Alafu the issue about mtu amekuwa suspected, because mtu somebody is suspected if they have come in contact with somebody who has the virus. So if today I have a virus and I have come in contact with you people, let's say there was a house party or we were in a matatu together, all of you will be suspected. So you will be tested. So you may be negative or positive. So that's now what happens. Just because mtu amekuwa suspected, haimaanishi ako nayo. So, and then the larger Kitale, I would assume, because they picked 2 people kwa area Kadere, Kitale is a big place. Maybe there were some 2 other people elsewhere that were picked or that were tested positive. Lakini it's just suspect, then you confirm. If they are not, then you remove them. Alafu mtu amekuwa confirmed, anafaa kuwa in isolation. And preferably, kama si mtu mgonjwa, kama si mtu mzee, aenda tu home na akae tu in isolation for 14 days. Alafu Michael alikuwa anaulizia juu ya what is the relation between COVID na homa na asthma. So COVID tuseme ni homa pia. But sasa this is a bad form of homa. But kuna watu wenye upata common cold, flu, and they really go down. So you can imagine COVID is like one of those. So the symptoms are the same. You'll have a cough, you'll have a fever, you'll have difficulty in breathing. Alafu pia tunasikia kuna watu ambao they lose their sense of smell. Some lose their sense of taste because of where those nerves pass up, and so it can be easily affected by the virus. So they are more or less the same in terms of symptoms. Now the difference with asthma is that mtu ako na asthma atapata fever. They'll have difficulty in breathing, they'll have a cough, but they'll not have a fever, because this is an allergic reaction, either to the cold or to dust, to something. So they'll not have a fever. So kama mtu hana fever na kona all of these symptoms, just don't assume it's COVID. But mtu akona asthma, it's not that they are immune to COVID. They can also get, and it can make their asthma worse. So mtu akona asthma ama any chest conditions, akianza kupata these symptoms, anafaa kuonekana as soon as possible. And preferably apigie doctor, aulize for an appointment so that they are seen, so that people can prepare for them, because unajua ukiambush and labda uko nayo utawaambukiza. If those ones go on quarantine, nani atashughulikia watu wengine? So the issue of age 13 to 30, children less than 13 years and people more than 58. So watu ambao wamekufa COVID, more than 50% are above the age of 60. Ni wazee. That's why tunasema wazee are very critical. Ndio tunaambia watu, yes mmefunguliwa, lakini kama uhitajiki kwenda ushago, usiende. If you must go, go. Na ukienda quarantine. Waeleze mapema that, because you don't know your status. Because hao ndio wamekuwa highly affected. So atutaki hao watu mingling with other people wakipanda matatu, sijui wakienda church where there's crowding. So you want to avoid that as much as possible because wakipata, chances of them surviving are very low. So we want to protect them. Now the issue of children, watoi hawajakuwa affected as much, but from what we saw earlier on from China, from Italy, watoi ni kama ni carriers. So watakuko wa sick lakini they'll sambaza the virus. So you can imagine your toys and your grandparents, they want to play, they want to tell stories and hang around. So if kids are carriers, watasambaza. So you want children to not get infected because utaki wasambaze.
All right. 23 minutes to 9 a.m. Whatever questions you've got about COVID, we are here with Dr. Korir to demystify all those questions that you have. Ndio siku ati mimi nimesikia bedhe ukikunywa chai moto corona huwezi pata. Nani alikwambia hivyo? Who told you? Na bedhe hiyo story ya watoi kwa carriers. Umeipata homa ya mtoi? Exactamente.
Good vibes only on Vibes Radio.
Call us up 0719-012-700. What would you like to know about COVID? We've got Dr. Korir in studio and she's answering all your questions.
So before you pick the next ones, let me quickly add that especially for my youth, watoi, if you are feeling unwell and you have any flu-like symptoms, it could be a cough, you are feeling fever, ama what people usually say, nasikia mwilisi yangu, kaa home. Stay home for at least 14 days.
Jesus.
Yes.
Leave days.
HR watakubali.
Or you'll have to find a way. But the best thing is you stay home because it could as well be COVID.
True.
And if you're out and about, I'll talk about mask. If you're out and about, then imagine unapanda mat, umeenda job, umemeet wase, umeenda sijui kutembelea nani na nani. If it was COVID, imagine watu utakuwa umesambazia.
So if I'm young,
you're a carrier. It is not about you. But about others, the people you are going to meet.
But you see, Brayo, me have a mask yangu because I'm protecting others. Because when I put on a mask, it's protecting others, right? Me to sanitize because I don't want to get COVID. Lakini tekia kwa matatu, mtu, he knows.
Lakini
mapua yake iko nje ya mask.
But sasa that is what we need to address kwa kila mtu. I observe these measures because it is not about you but about everyone around you. So mask mtu alikuwa anasema your chin is not the problem. It's your mouth and your nose. That is what is supposed to be covered, and it's not also your forehead. It's your nose and your mouth. Wash your hands. And if you're unwell, stay home. It is part of the safety measures because utaki kusambaza. Because if you're diagnosed, let's say today, si utaka home. Because you're not being admitted to hosi. Ka home. Wait it out, hydrate, kula vizuri, do everything that you need to do in order to be safe.
Wait, Dr.
and protect others.
Do you know Africans? Are you from Africa? Kabla mtu aende hosi. You know it.
But you see, COVID watu wamekuwa kikimbia hosi. COVID watu wamekuwa kikimbia hosi, but now we are saying usiende hosi, ka home. Stay home, especially if you're not in that category. People above 55 years of age, kama una diabetes, hypertension, cancer, kama una any of those other diseases, ka home.
All right. Call us up 0719-012-700. You have about 5 minutes with Dr. Korir. You can ask her anything you want. Lakini the time is now. Kumbuka, this series is called If We Continue to Behave Normally.
Kwambox, may I have a question for Daktari?
Yes, you feel free.
On social media tulikuwa tunaona mastori za if you get COVID, kuna venye unateseka, utakuwa kwa hosi. Then there's another angle that came. They said your lungs can be damaged. Are there chances that are high that even if you recover from the disease, it will have affected your organs permanently?
So I'm going to ask you to hold that thought. Let's get more questions. We got Rambo. Habari asubuhi. Rambo bana anajisikia kwa redio. Piga simu nambari 0719-012-700. Nubian Mfalme. Good morning. King.
Yeah, what up?
What up? Habari ya Togoto?
Tuko salama, njeve tu inanyesha tu kama kawaida.
Nimekuambia vabo shori mazi. Vabo shori. Sasa, King. Unataka kuuliza daktari nini?
Nataka kuuliza hivi. how much is the Kenyan government getting per patient from the World Health Organization?
Daktari si wa gava bro.
Si wa gava.
Hapana, tuambie ama daktari anajua maneno.
Hapana, cheki. Yeye amekuja tu hapa for the sole reason kujibu swali yoyote yenye uko nayo. Nubian, wewe kwanza unavanga mask aje? Uliza za corona pekee.
Za corona pekee. Sasa hiyo ilikuwa ya corona because each country there's an amount given per person per each day like with new cases going on.
Okay, King. Me sijasikia hiyo story. I just know the one about how much it will cost you if you get COVID. For example, ukiipata and you're really sick, one day in ICU is an average at the very minimum 51,000 shillings per day. Yes.
Okay.
Kama una symptoms zozote na uende hosi uadmitiwe, prepare to pay at least 21,000
Jesus
per day. Yes, ndio sababu tunasema ka home. Ka home.
Hiki tu kwa government alipa?
Hosi za government wanasema ziko overwhelmed. Ziko na watu zimejaa. So ka home. Usipate ugonjwa.
Can you clarify that there's so much misinformation coming from both the government and the masses? Is that true?
I wouldn't say it's misinformation, but it's lack of clarity on what the actual situation is. Because ukiuliza kwa ground, madokta wanasema hosi ziko full. And I can believe that because unaona saizi tuko 8,000, alafu kila mtu anaadmitiwa, hata watu wenye wanafaa kwa home. So ikifika point yenye ni mtu ni msika anataka kuadmitiwa, there's no space. So it could happen. That's why the message is kuna home based care protocol ka home. Ukijisuspect ama kama umecome in contact with mtu mwenye ako nayo ka home. Because you can imagine hizi costs zote 51,000 per day unatoa wapi? Unatoa unless umeloot mahali, you can't afford 51,000 per day. So afadhali tu kae home, make sure usipate ugonjwa ama make sure watu wako asipate, kwa sababu hata watu wakipata kwa familia unajua ni shida yenu nyinyi wote.
Imagine
all of you have to changia 51,000 per day. So if you have to stay there for like 20 days, because on average watu wako ICU wanaka like about 3 weeks.
All right,
that's a million bob.
Let's take another phone call. We got hello.
Hello, how are you?
Fine, thank you. Who are we speaking to?
Yo, you are speaking to Robert from Doha.
Robert, karibu sana. You're on Morning Vybez with Kwambox Mbunde and Dr. Korir. What's your question?
Actually, it's not a question. But what I want to clarify is that, the problem is COVID, African problem now. They turn it into a business. So that is why people, they are not believing that there is COVID, Very many people, they are not sure that COVID is there. And African people, they want to believe. They want to first see, then they believe that COVID-19 is there,
Yeah.
Like, because last week I was in Italy.
Yeah.
Last time I was in Germany. I saw people, very many people, they are burying their people. But when you go to Africa, you can't see anybody burying someone. That is why people, they don't believe it, And another thing is like, some people, they don't know medicine. Right now, I'm in Doha, because me, I was a victim of COVID. But the fact is, people, they are using lemon and ginger. It is very good. And another thing, they have to use, hot water. They have to use hot water. They mix some kind of salt. After that, they cover their head. They have to put in a bucket hot water and salt. They cover their head. At least that one is another option. It's very good, but when you go to Africa, they don't know that kind of trick. But
so you're saying
that is what
you're saying they're using natural remedies in these areas that you've been in. You're in Doha right now.
Yeah.
Okay.
Yeah, that is what they have to use also, but some people, they don't know that kind of trick.
Okay. Well, we appreciate you calling in and sharing with us this morning.
Okay. No. But you people, you are very good. That kind of you are very good, actually.
Thank you so much.
You have presented very well.
Thank you. We appreciate it. All right, we got listeners from all over the world who are interested in this conversation, and I can tell you that there's many more online. Doc, as we wind up, and I feel like we need to keep having this conversation because on ground, are you worried people going to Shago?
Of course I am. Of course I am, because when I think about Ushago and the kind of healthcare infrastructure that is there, if people fall sick, it's gonna be bad. It's gonna be bad. It's not. You see, Nairobi, Mombasa, Kisumu, Eldoret, those are like on a different scale when you come to healthcare services. But imagine somebody has gone to somewhere in Narok, Kapenguria, you know those places, and they need an ICU. What happens?
Kwa kina Brayo, ata kuna stima.
So, just first of all, the road infrastructure, how you get even to hospital is already bad. And then when you get to hospital, even if they have a monitor or something, do they have the specialist? So when I think about the kind of health infrastructure that we have in the periphery and people trooping to Shago, I'm worried. And then two, your healthcare personnel, most of them are concentrated in the cities that I've talked about. So even if you need somebody to react and do something and help you out there, then your chances are really slim. So that's my worry, because I think if people start falling sick in Ushago, it's going to be bad. And we'll know that in another 14, 21 days.
Doc, let's try and be positive. Let's assume that the people who are going shags had to go to shags. You know, maybe you couldn't pay rent, you couldn't, you were just like, I gotta go home, I gotta get out of here. They're already now going to shags. What tips would you give, because at the end of the day, there's no medicine. It's not like utatelpeleka hospitali utritiwe. So what actions can they take?
So those who have to go to shags or who have to travel out of the cities or go elsewhere, isolate for 14 days. It's just for your own sake and for the sake of the people, your loved ones around you. Isolate for 14 days. Have as minimal contact as possible with other people. Maybe somebody who's younger can come in contact. You can still interact, but at a distance with everyone else, but don't meet. Don't go hugging your parents and your grandparents. Don't go salimeing all the kids in the village, because those kids, they'll come, they'll be happy umetoka Nairobi, then they'll go and meet other people. So just isolate. And you see, the beauty is even people in Ushago are woke. When you go there, they're like, nyinyi watu wa Nairobi, kaeni kando. So hata watu wa Ushago, make sure that those people have isolated for 14 days. After 14 days, kama mtu wako sawa, then you can continue living life as normal. So I think for me, 14 days is a small price to pay as compared to if somebody was to fall sick, if they were to die, or if they were to go into Hosi and you incur all of this cost, you already don't even have a pay. How are you going to pay all of these costs that might come with it?
Wow.
So keep off.
I would have loved to hear yesterday when this announcement was being made with this, Guys, as you go to shags, isolate for 14 days. I'm grateful that we have you, that you could be able to share this information with us. Brayo,
yes,
I can see sahi kichwa na kuuma hizo information ni more
bado kuna swali ya Brayo about lung side effects. So people are still looking and studying to see if these are permanent or they are temporary, because the people who really had very, very bad lung disease died. So we are yet to know of those who survived. How is it? Our people here who have COVID, they've not had any symptoms, so their lungs are fine. So these are still studies going on. We learn as we go along.
As we go. But remember, guys, key thing, sanitize, social distance, va mask. Useme ati ukushago sasa na va mask, watu wananiangalia ni kama ni ninja. Kuwa ninja bana.
Vybez Radio, we rule the nation in this generation.